Dr. Aditya Shetty. Semi-compliant versus non-compliant balloons in anterior venous access salvage. Novel study.
Good morning, everyone. So I'm Dr. Aditya from Institute of Nephrology, Bangalore. I'll be presenting my paper titled Semi-Compliant versus Non-Compliant Balloon Systems in Arteriovenous Access Salvage, a novel study in India. So for introduction, the longevity on dialysis is directly proportional to the quality of dialysis, and that quality in turn depends on the reliability and the integrity of the access to the patient's vascular system. AV access flow dysfunction refers to clinically significant abnormalities of AV access, fistula or graft, flow or patency due to underlying stenosis, thrombosis, or any related pathology. So KDOQI considers it reasonable to use balloon angioplasty with high pressure as needed as primary treatment for AVF or graft stenotic lesions that are both clinically and angiographically significant. So the types of balloon, before going to the study, I'll just mention briefly regarding the types of balloon systems which are used. One is semi-compliant balloon and second is non-compliant balloons. The compliance of a balloon catheter is defined by the diameter increase that results for a predetermined increase in the inflation pressure. So semi-compliant balloon systems respond to an increase in inflation pressure by initially increasing its diameter in areas that lie more, as seen in this image below. Regions proximal as well as distal to the lesions dilate first, followed by regions of more resistance later on. And this effect is called as dog boning effect or dumbbelling phenomenon. Whereas a non-compliant balloon system expands more uniformly over the longitudinal axis and generally cannot be expanded past a predetermined maximum diameter. Therefore, non-compliant balloon system offer the advantage of deforming in a more predictable manner and a stable manner during inflation as compared to a semi-compliant balloons where dilatation occurs predominantly in regions of least resistance primarily. So in our study, patients were divided into two groups based on the balloons which were utilized for treatment of their lesions. Group 1 included patients treated with semi-compliant balloons and Group 2 included patients treated with non-compliant ultra-high pressure balloon systems. Now, technical success was defined as residual stenosis less than 30%, and primary procedure failure was defined as inability to successfully dilate the segment to more than 70% of the lumen of the adjacent vessel. So this was a retrospective study comparing non-compliant versus semi-compliant versus non-compliant balloon systems, and data was collected from the hospital records for interventions done from 2016 to 2021. All patients with follow-up up to 6 months were included in the study. Baseline characteristics, outcomes, and complications of endovascular AVF salvage procedures were compared between the two cohorts. Finally, during this period of time, 122 patients were included in the study. Baseline characteristics, semi-compliant balloon systems had 43 patients included in this cohort, as 53, as opposed to 69 patients in the non-compliant balloon system group. Both groups were predominantly male, with 73% in the semi-compliant and 76% comprising of male individuals in the non-compliant group. Mean age was comparable, 57 years in the semi-compliant group and 58 years in the non-compliant group. Significant comorbidities, hypertension was the most common, which was seen in 81% of the semi-compliant group and 78% in the non-compliant group, followed by peripheral vascular disease, which was seen 54% in semi-compliant versus 58% in non-compliant. This was followed by diabetes, again similar, 53% versus 58% in semi-compliant versus non-compliant group. Regarding the axes which were used, in the semi-compliant group, we see predominance of brachiocephalic axis which was used, which is 82% of the individuals, whereas around 18.8% had radiocephalic fistulas. Whereas in the non-compliant group, proportionately radiocephalic was slightly more as compared to the semi-compliant group, which 36% had radiocephalic fistulas as opposed to compared to 64% who had brachiocephalic fistulas. And the duration of access in the semi-compliant group, 62% of the individuals had functioning access for more than 3 years before they developed these lesions. Whereas in the non-compliant group, we had 54% of individuals with access life of more than 3 years and 46% of less than 3 years, relatively new access. So nature of the lesion in each group, the most common lesion seen in both groups was outflow vein stenosis, which was 51% in the semi-compliant group and 45% in the non-compliant group. This was followed by inflow stenosis, which was 34% in the semi-compliant group and 29% in the non-compliant group. Semi-compliant group did not have any individual with mixed outflow and inflow stenosis. We couldn't find any documented lesions at that point. Whereas in the non-compliant group, 12% individuals had mixed lesions. So results, technical success was, which is defined as more than 70% reduction of the stenosis, was seen in 83% of the individuals with semi-compliant group as opposed to 93% of the patient who had received treatment via non-compliant balloon systems. And primary procedure failure was more in semi-compliant group, 17% as compared to 7% in non-compliant group. And procedure-related complications were seen in 7% of semi-compliant group. And most of these complications were outflow vein ruptures as compared to non-compliant group where 3% of the individuals had complications. On follow-up at 3 and 6 months, semi-compliant group of the individuals who had successful treatment, the individuals in the semi-compliant group at 3 months had 63% had functioning fistula access at 3 months. As compared to non-compliant group where 98.5%. So most of the individuals had functioning fistulas at the end of 3 months. On further following up for 6 months, we could see that same percentage of people had functioning fistulas in the semi-compliant group. So predominantly most of the failures or restenosis occurred within the first 3 months following treatment. Whereas in the non-compliant group, 95% of the individuals had functioning fistula, so 3.5% reduction in functioning fistulas from 3 months to 6 months. So to conclude, this was the first Indian study to look into semi-compliant versus non-compliant balloon systems used for access salvage. Our results were comparable with a meta-analysis which was published from China, which was again comparing semi-compliant versus non-compliant balloon. Even in their study, they found that better outcomes with non-compliant groups and more functioning fistulas at 3 and 6 months. But in their studies, by the end of 1 year, they found that 9 studies were assessed there. They found that similar rates of functioning fistulas at the end of 1 year. So a lot of benefit appears to be in the first 3 to 6 months. And so our study showed that ultra-high pressure balloon appears better with regards to procedural success, rates of complication, as well as long-term outcomes. Thank you.
Yeah, that was a good paper. When do you decide which balloon to use?
So in this our study, at that point it was taken patient-to-patient basis. We had not, a lot of patients at that point were, say early from 2016 to 2019, most of the patients had received treatment via semi-compliant balloon. Later on, as practice has migrated to non-compliant balloon system, most of our follow-up patients have received on non-compliant. So there was no randomization per se. This was patients who were retrospect treated, were just files were.
Is there any, characteristics of AV fistula? This patient, this fistula, this balloon to use, this fistula, this balloon to use?
Nothing, nothing as such.
Nothing.
Now most of the system we are using non-compliant balloon system itself.
Okay.
Okay, let us invite questions from the audience.
I think Dr. Shetty, it is a wonderful work which you have done at your center. Being a nephrologist, you are doing all this kind of interventional nephrology work. I have to compliment that. But the question is here, I think since you have told your practice of using the balloons are different when compared to the 2016 and now.
Yes.
So the kind of difference we could see in this particular thing could be because of this change in your policy of using the different balloon of late.
Yes.
So since it is a retrospective study and there is no randomization, it is difficult to interpret the results which you got, from non-compliant and compliant. Is the one issue. And regarding the outflow stenosis, especially in the vein, most of the time these interventions are not found to be very effective. So do you have any real comparison between the inflow stenosis, that is the arteriovenous anastomotic site stenosis versus the distal venous stenosis? Which one was found to be more effective with these two types of balloons?
So in our subset, we had uniformly better outcomes in non-compliant groups. But again, even in the meta-analysis which was subjective, and even you can see in our study, most of the failures occurs within the first 3 months, even in the semi-compliant group. So on long-term follow-up, most of these lesions do go back to recurrence of lesions. But that free period of functional good dialysis is offered to the patient.
Yeah.
Hello, I'm Dr. Shabna from Calicut ICRA Hospital. So I would like to ask whether the apparent better performance of the non-compliant balloons, could it have anything to do with the choice of the AVFs that we performed on? Because it was predominantly the brachiocephalic fistulas that it was used for.
So as you could see in a subset of patients in the non-compliant system had proportionately more radiocephalic fistulas as compared to the semi-compliant group. There were lesser brachiocephalic fistulas. And in any case, they have not found difference in outcomes based on the fistulas. So radiocephalic or brachiocephalic, there are no comparison as to balloon systems. Success rate is more with one fistula with regards to another fistula. There is no such differentiation. Primarily depends on the lesion and the severity of the lesion.
So thank you, doctor, for that very good paper.
Thank you.
Let's go